Addiction medicine has made a lot of strides in the past 20 years. Most recently, we have become a certified specialty in medicine as of 2 years ago. So people in addiction medicine are very into trying to treat the patient medically as well as behaviorally in this disease, because we really believe it is a brain disease. And when people first come into us, a lot of people have difficulty withdrawing from their medications or alcohol or drugs that they've been on. And it requires a medical management to get them through that process. Particularly with alcohol, without medical management, people can have seizures and die. Also with benzodiazepines, medications like tranquilizers are very dangerous to come off without being medically managed. We also have opiates, of course, which are the prevalent drug right now, either prescription opiates or heroin. You don't die from withdrawal from those drugs, but it's extremely uncomfortable, and people go through a lot of withdrawal symptoms. And that's what keeps people away from treatment sometimes, that they don't want to experience that withdrawal syndrome. So we have medication now that is available to them to make their detox a lot easier. When a person comes in to our medical and nursing staff, we do a very careful nursing assessment. I do a very careful medical assessment and workup, spending an hour or two with a patient, getting their entire medical history, make sure that they're healthy, do a complete physical examination on the patient to make sure that there are no underlying diseases, do some blood work to make sure that there's nothing hidden that we're not catching. And I want to be sure the patient is safe in our environment and make sure the patients that are already here are safe, make sure that this person coming in is stable enough to do the program and interact physically and emotionally with everybody here. So we have to be sure they're medically and psychiatrically stable too. So that's part of the process too, to make sure that they're not suicidal, that we can treat their depression, bipolar disorder, whatever it may be that may be interfering with their recovery process. And once they get into our residential treatment, once I get them medically stable, and that may take 1 to 5 days in our specialty hospital here at Serenity Lane. After that, what I do is follow the patient medically and psychiatrically while they're here in residential to make sure they're staying stable. I think the important thing is when you bring somebody in for this disease, they're full of shame, they're full of guilt. We treat our patients with as much dignity and feeling as possible, and with compassion, because we know they feel very small about their disease, and there's a lot of guilt, and they don't understand that they have a brain disease. And when they learn that process about what's going on in their brain and body, they start getting healthy right away and realizing there's something they can do and there's treatment for their disease.